everyone, my name is Amanda Nunez and I'm doing my final presentation of the UMOM New Day Centers and their program evaluation. So the purpose of an evaluation is to determine if current programs are effective, determine what stakeholders are interested or what they have questions about, and to determine how to make current programs more effective. So in other words, how can we better utilize the funding that UMOM already has to make a greater impact on the surrounding community. So for UMOM, they are based out of Phoenix. They've been operating for the last 56 years. Their goal and their mission is to end homelessness, rebuild lives, and ultimately transition people into permanent housing. And in some cases, they even prevent homelessness by connecting individuals with additional resources. So for the UMOM evaluation, one might ask, well, who cares about the evaluation? Who's using it? And what really are we going to do with the evaluation? Well, first you have to identify who UMOM stakeholders are. Now, at first you might just think, well, who might be interested in UMOM? That's likely going to be the local homeless population. In addition to the local homeless population, it's going to be the local EMS, which is Emergency Medical Services, police departments, the local government, as well as the federal government that provides a portion of UMOM's funding. There's also private donors. Private donors make up approximately 51% of UMOM's funding for the year. And there's about 30 members of UMOM's board of directors who are all representatives for corporations who made large donations towards UMOM. So to go back through these, EMS would likely be interested in UMOM because they are getting some of these homeless individuals off the street, connecting them with additional resources. And one set of individuals who's often the first contact for homeless people are police department and is also our local emergency medical response team. So they would probably want to know what exactly are we doing, what emergency resources are available to people. Now the government's providing about 49% of UMOM's funding, and they do this because UMOM serves as the family housing hub for Maricopa County. So what that means is they're the entry point into the shelter system for families who have children under the age of 18. They can either get them emergency resources to help prevent homelessness, or they can go back, get them emergency shelter if they are already experiencing homelessness. And the goal with UMOM is transition from the emergency shelter side of things to eventually getting to the permanent housing side. And they offer several programs in between that help individuals to get there. So what this looks like is UMOM's logic model, essentially. So UMOM operates by using several smaller programs to reach their end goal of putting people into permanent housing. So the inputs for UMOM are, like we talked about, the government agencies who help fund it, the private donors, as well as their many volunteers and staff. They have several thousand volunteers each year. And what these inputs do, they lead to UMOM being able to develop several different activities. These activities include the emergency shelter assistance, rapid rehousing. There's different child programs and child care programs for individuals who are utilizing UMOM's resources, as well as fundraising and administration work. Although many people don't like to talk about that side of things, there's no way UMOM could operate without the fundraising efforts put forth and without the administrative side organizing all these different moving parts, all trying to accomplish the same goal. The outputs from these activities include a smoother transition to permanent housing, and there's also the about 900, almost 1,000 people in 2018 who UMOM was able to keep from losing their housing overall by providing assistance when people were in need, not just waiting until they just needed shelter assistance. But they also provide that shelter assistance, which results in an increase in sheltered adults. There's also decreased barriers to permanent housing, which is seen with the emergency shelter assistance, the rapid rehousing program, and the child care programs all work so individuals have that opportunity to get back on their feet, help develop those resources and skills they need. In order to do all this, there's the operating funds that's organized by our administration and the fundraising efforts. So some of the short-term outcomes of UMOM includes a decrease in unsheltered homeless, as well as prevention of homelessness, as we discussed, and improved access to essential services and resources. Many individuals in the homeless community don't necessarily have access to computers and to different administrative sides of things that they need in order to be able to get jobs or build those skills and become financially secure. So the intermediate outcomes for UMOM include individuals developing those skills, and those skills include job skills, obtaining employment to the job fairs and other corporate partnerships that UMOM has, as well as a better understanding of financial management and what they need to do to move forward. And to go along with that, once individuals have developed those skills, they can now attain and retain permanent housing. The goal is to get people into permanent housing and have them be able to successfully manage that. To go along with both of those, the sooner people are out of homelessness, especially families with small children, there's shown to be increased stress on these children, increased strain on that parent-child relationship, because parents are so invested on just trying to have food and trying to be safe for another night that they're not able to truly bond with their children during this time. So intermediate outcomes from UMOM's rapid rehousing efforts and decreased barriers to additional services and decreased barriers to permanent housing is an improved parent-child relationship. Now, long-term goals and outcomes of UMOM is a decreased prevalence of homelessness within the community. After we generate this system of preventing homelessness and people identifying UMOM as that resource within the community to do so, there can be a decreased overall rate of homelessness by getting people into permanent housing and preventing homelessness from occurring in the first place. This will eventually result in a decreased use of public assistance. Now, initially, UMOM is getting individuals connected with different forms of public assistance, whether it's low-income housing, getting them on food stamps, getting them access to Medicaid so they start managing their different health conditions. But as these individuals continue to grow and build, they'll eventually have a decreased reliance on this public assistance. Another long-term goal would be an improved management of chronic health care conditions. My background is working as an emergency nurse and doing various homeless outreach projects. And a major thing I see is you can send people out, you can give them great discharge education, but they just don't have the means to care for themselves. It's not necessarily the top priority, one might say, although it is important. You have to deal with the immediate threats while you're homeless, which would be finding shelter and making sure you have food and making sure your kids are safe and taken care of. So healthcare kind of falls on a back burner. Once individuals work with UMOM, they have several medical clinics that they partner with, as well as getting individuals enrolled in Medicaid or Access, which is Arizona's Medicaid. So they're now able to get this preventative medicine and manage these conditions so they're not getting worse, which is ultimately going to lead to lower healthcare costs. Now, this is important to stakeholders because government stakeholders, as well as community members, are concerned about how much is being spent on things like the Medicaid program. And oftentimes, individuals who are homeless are just using the emergency services system for healthcare services when it could have been a minor condition managed by a primary care doctor a week or two ago. They put it off until it's now an emergency and costing far more in healthcare expenses. So ultimately, this will lead to healthier future generations of individuals because they'll have access to health care and preventative medicine and not end up with these dangerous and very oftentimes uncomfortable or even disabling conditions. So the evaluation focus is going to be on several questions that we've gone through with the CDC evaluation checklist to ensure they meet the requirements. So the first question that stakeholders would be interested in is, what progress has UMOM made in readiness and job readiness and employment? So UMOM has their annual or their semi-annual job fairs, sometimes even more often, as well as helping with resume building, that kind of thing. Additional questions that will be asked in the evaluation are, what percent of households exited the program to permanent housing, and how many of those did not return to homelessness within the year? That not return to homelessness within the year is the key portion. That are these resources being well used and getting people into permanent housing and keeping them out of homelessness? Or are we investing a large amount of funding and time and resources into this program, and they're just returning to homelessness right within a year? So are there any other gaps that we need to fill within that program? And then, what participants are satisfied with the delivery of the program / pathway into the program? Is it easy to use? Is there too much paperwork, or is there something that individuals need help filling out, or is it a time issue? These are all questions that are kind of packed into that one that may be answered by individuals who've already gone through the program. The fourth question is, what's the economic impact of rapid rehousing with UMOM? That was already kind of discussed as I was discussing question number 2 of how many individuals exited into permanent housing and did not return into that. So rapid rehousing is the main program that's getting people into these permanent housing options. So how much of an impact is that truly making? Are we saving money that way? Is the program best using resources so we're decreasing the number of homeless individuals on the street? And we're also improving these parent-child relationships by getting individuals into this permanent housing. And then the other question is, what has been UMOM's impact on health and healthcare cost savings? So we just went through that logic model, and we can see how getting enrolled in Medicaid and having a primary care doctor and being able to utilize these resources as they're intended to be used, how that can result in a long-term cost savings and better management of long-term conditions. So there are some resources with the CDC and the Maricopa County Public Health Department that can be used to identify an exact number of what's the cost savings or an approximate cost savings based off of the reduction in homeless individuals. And now question 6 works with which program at UMOM is yielding the greatest results and how much funding goes towards that program. So this question does not meet all the CDC requirements, as well as the other question asking the economic impact of rapid rehousing, because these are quite broad questions. However, they do help to tie the focus of the overall evaluation together, and they are essential questions to the program. These are the big questions that people want to know the answer to. Now, the answer to question 6 of which program is yielding the greatest results is going to be a bit more complicated because the rapid rehousing program cannot stand alone. The rapid rehousing program relies on the job program, the child care program, decreasing these barriers to get people there. As you can see on the screen, these are the various questions that are being asked and how often we're going to be communicating with various stakeholders. Well, at least communicate with stakeholders on a monthly basis and as needed in between there as well. There'll be oral presentations, WebEx meetings, as well as emails and brochure handouts so individuals can follow along and hopefully have as little technical difficulties as possible. Additional details for the final evaluation program can be seen in the written out evaluation packet. Please feel free to reach out to me with any other questions on UMOM's current practices, the program evaluation, and how these questions are really going to turn the direction of UMOM's programs and make this greater impact with the same amount of funding. Thank you.